It is one of the great fears in this area, especially this time of year, Lyme disease. To separate some of the fact from fiction about Lyme disease, I'm joined by Dr. James D'Amour from Christiana Care. Doctor, thanks so much for being here. I was telling you a moment ago that in my family, my wife believes every time someone's sick that it's Lyme disease, because there is that paranoia, is there not?
Absolutely, Larry. In this area where Lyme is endemic, the ticks that live here are infected with it to some degree. So we always have to keep it in mind when we have potential tick exposure and symptoms that might be suggestive.
And how do you know if you have Lyme disease?
Well, the classic experience is the bullseye rash. And I think most people have either heard about it or maybe even seen a picture of it or had it themselves. But that is the ever-expanding pink or red rash that eventually starts to clear in the center, so it ends up taking on the appearance of a bullseye.
But why is it so, if that is one signal, and that would be a big one, why is it so often misdiagnosed?
Well, not everybody gets the bullseye rash. You might only see that in 70–80% of the cases. And there's some soft, variability in that number because you don't know if the patient just didn't see it or if they actually didn't get it. If someone gets it on their back and they live alone, they may never know it's there.
Is it on the top of mind for medical professionals, Lyme disease? And the reason I'm asking the question, let me set it up this way, is because there's so many people I know that have been sick and gone to get checked out. And they say it's the flu, or they say it's a cold, or they say it's something else, and it's not for a while that they're diagnosed as having Lyme disease. You would think because of this area, as you said, it would be one of the first things they would check for.
Well, as I mentioned, there is some seasonal variability. As I alluded to earlier when we were talking, if it were the middle of the winter where you don't get tick exposure, obviously you're going to think, well, gee, there's flu in the area, this is probably a flu or a viral illness of some sort. But once you get into springtime where flu is pretty much gone and you start having people present with symptoms of fever, joint pains, muscle aches, headache, and they tell you, well, I'm an outdoor enthusiast. I like to jog in the woods. I like to ride my bike on the trails. Then that's, in this area at least, something you would think of immediately.
Or if you live in a wooded area, I know some people that have been bitten by ticks in their own homes. I mean, it's...
Well, absolutely, especially if you have a property that abuts, say, a natural area, like a state park or something, where you have deer going through your yard, or maybe you have fox there, you hear them squealing at night, because the deer tick actually live off of deer and fox. And so having those animals in this area would potentially expose you to ticks from the ticks that live off them anyway.
There's so much misinformation out about, because it's a scary disease to a whole lot of people. I thought it was fascinating when you said, caught early, it's easily treatable. Does it come back? Is it a recurring disease once you get it?
I think there's some debate on that issue. I think largely the belief is that if you caught it early and treated it with an adequate course of therapy, that it's done. There's some misunderstanding there because the testing that we use is an antibody test, and it may not always go away after your first infection, meaning there may be some persistence later on. So if you have another illness, say you have another febrile illness and you're checking a Lyme disease titer at that point, it's hard to interpret as, well, is this from the old infection? Is this something else with a residual? Or is this a new infection? So that creates, I think, a scenario where there's some uncertainty. Is this really recurrent infection, or is this something else? Or is this actually a new infection? You got bit again and now you're infected again.
How do you prevent it?
Prevention is key. When you get into a disease like this where there's vagueness and there's uncertainty about treatment, certainly in the more severe chronic phases, an ounce of prevention is worth a pound of cure. So tick avoidance is going to be number one. And if you're someone who is just determined to, expose yourself to nature and just, you're an outdoors person, then avoidance isn't always something that you're willing to do. So in that case, you just become very conscientious about checking yourself for ticks, wearing light-colored clothing so you can actually see them on you, tucking long pants into socks so that they can't get up inside your pant leg. Things like that. These are commonly recommended techniques to avoid tick exposure. Also, insect repellents such as DEET are very good at repelling ticks. If you're someone who likes to spend a lot of time outdoors and you tend to wear the same coveralls when you're out in your garden, you can actually even treat that clothing with permethrin, which is an insecticide and that will just kill the ticks if they get on it.
Oh, that's great. It's all important information. Thank you very much, Doctor. I really appreciate you
pleasure.
coming in to tell us about that.
Thanks for the
Dr.
invitation.
James Damore from Christiana Care. Stick around. The Delaware Way continues right after this.